I don't know when exactly.
Okay, fantastic. Thank you for sharing that, John.
Sure.
All right, the time is now 0900 hours on July 21st. Thank you for showing up, carving out time in your schedule this Thursday morning. I know more people are going to jump on soon, but I'm all about on-time takeoff. I want to be mindful of your time, and I know that sometimes we have back-to-back meetings. So I hit the record button, and I'm thinking more people will pop on here in a minute. But I'm retired Lieutenant Colonel Xavier Bruce. I go by Dr. X. As John mentioned, I'm an Air Force Academy grad of 2000, and I'm the new program manager for Serving Together for Central Maryland. I took over Katie Kilby's spot, and I tell you, these are some big shoes to fill, but it's an awesome opportunity to get into my passion and my purpose about veterans, family members, and service members. So I'm glad to have this opportunity. For those of you all that don't know, Serving Together is committed to coordinate care for our community's active duty, veterans, and military connected families. In this collaborative, as well as some of the other collaboratives out there in Central Maryland, this is an effort to broaden the knowledge of those that come on these calls and the understanding of the available support that we have. And while each of us can do all things, we shouldn't try to do everything. So the goal is to share where your mission starts and stops. That way we can do a warm handoff to other organizations that you meet on this call. We have teamed up with iCommunity Connection Services to assist with leading the Arundel Collaborative meeting. So at this time, I will turn it over to the Chief Executive Officer of iCommunity Connection Services Incorporated, Ms. Kia Chandler. Over.
Good morning, everyone. As Dr. S just said, I'm Kia Chandler, the Chief Executive Officer of iCommunity Connection Services. I do know or have heard of most of everyone that's on the call. I should also report that many of you also might be familiar with iCommunity Connection Services, as our board chair is Ms. Gloria Dent, a veteran herself, a distinguished veteran herself. So iCommunity Connection Services is partnering with Serving Together to help facilitate the collaborative. And we are also the nonprofit agency that is collaborating with Anne Arundel County to provide case management services to veterans all throughout the county. And as many of you know or have heard, that this was an initiative that was kind of spearheaded and pushed through the Veterans Affairs Commission. Today we're kind of reshaping how we're doing the collaborative, kind of trying to restructure and kind of just also trying to, I guess, get some ideas from you all and what you want to hear going forward. But at the beginning, we will continue to do and invite speakers. And then afterwards, we'll do like a roundtable discussion and just talk about what's going on in our different organizations. What we're seeing, what issues are coming that people are having, or what successes people are having. And then also just kind of talk about future topics that people want to see. But then I'd also like to introduce just us talking about upcoming initiatives and events so that we can all start to or continue to support each other as well. So with that, today's speaker is Justin Beeler, who is with the Department of Social Services, if you all don't know, and is in charge of running the homeless coordination efforts in Anne Arundel County. So with that, I'll turn it over to Justin.
Thank you, Kia. Thank you, everybody, for allowing me to speak today. Greatly appreciate it. Hey, John. It's been a while since I've seen John Church, maybe a couple of weeks. I wanted to just briefly go over who I am, and I have a PowerPoint. I could try to share my screen, Dr. X, if I have permission to do that. I think it might be a little bit easier to have some visual. So I just want to say I've been working at Anne Arundel County since I think 2011 is when I started here. I started in a much different capacity. When I started in 2011, the resources and services that individuals and families experiencing homelessness had was a lot different. There was not nearly as much, and it wasn't very coordinated. Since I guess it's since 11 years or so that I've been here, we've strived really hard to make changes to make sure that individuals and families not only had equal access to resources and services in the community, but those that couldn't access those resources and services, we put into place projects and services that would go to those individuals or families so that we could bring them to the resources and services or bring those services to them directly. When I started, we had an event called Homeless Resource Day that was a one-time-a-year event that provided a plethora of resources and services. More recently, in 2016, we decided that having a one-day event is nice, but there's 364 other days out of the year that people are in need. We started a street outreach team, and the street outreach team's goal is to no, I'm not sharing my screen yet, but I will in a minute. Sorry, I was just looking at chat. So the street outreach team's goal is to interact with individuals and families that are on the street that have not been able to make it to day centers, have not been able to access shelter, have not been able to access resources, partly because they don't know where those resources are, and partly because lack of transportation and other things. So we've done a lot in the past 10 or so years. I wanted to, and I could go on for hours and hours about all of this, and some of you guys would probably enjoy that, some may not. So I'm trying to be a little bit more concise and focus on just one topic for today, and that topic is coordinated entry. Coordinated entry, and I'm going to try to share my screen now so I can bring this up. All right, great. And I think I could move this here and click that. Coordinated entry. There you go. Coordinated entry is what we refer to as prioritizing those that need services the most. And you know, in about 2016, a lot changed, and we've learned a lot, partly due to HUD kind of mandating us make some changes, but also because we realized and we educated ourselves on who we were serving and how we were serving individuals and families in our county. And one thing that we realized is that for a lot of individuals that were experiencing homelessness, in order to access shelter, you would have to call Sarah's House, you would have to call Lighthouse, and you'd have to call Arundel House of Hope to be able to get on the wait list for shelter. So you'd have to figure out 3 different ways to get onto 3 different wait lists to access shelter. Similarly, when it came to our permanent supportive housing programs, you had to know how to get on those wait lists, and they weren't publicized very well. So we ended up serving people that were tech savvy or savvy with being connected with a case manager, and we ended up unfortunately excluding people that really needed the services but had mental health reasons or substance use reasons or other reasons that prevented them from being able to connect the dots to access the resources and services that they needed. That's where coordinated entry came in. The purpose of this was to consolidate all of these wait lists into one wait list and kind of have one kind of group look over these lists. So when I say what is coordinated entry, if you want to get a technical term, it's the process, the coordinated entry process, or CE, is an approach to coordination and management of a crisis response system's resources that allows users to make consistent decisions from available information to efficiently and effectively connect people to housing and service interventions that will rapidly end their homelessness. That sounds like a mouthful. I wanted to say that we take this philosophy and what we've done since 2016, and we continue to get better at it year after year, is we've consolidated 2 separate housing or shelter type programs. So for example, in Anne Arundel County, if you want to get into any of the 3 shelters that we have, there's only one way to do it. There's only one wait list for all 3 shelters, and it's managed by the coordinated entry team at Department of Social Services. So if an individual or family is experiencing homelessness and they show up at Lighthouse, Lighthouse is going to assist them at calling the coordinated entry line, and we're going to do an assessment, and we're going to add them to the wait list, not just to Lighthouse, but to Sarah's House and Winter Relief as well. Similarly, with our permanent supportive housing programs, instead of having 5, 6, 7, 8 different wait lists that people had to figure out how to get on, we now have one wait list. I'm going to expand on some of this a little bit more as we go on. These are the main services that individuals or families experiencing homelessness have in Anne Arundel County. Day and resource centers. We have one at Arundel House of Hope and one at the Lighthouse. So we have a spot in Glen Burnie and Indianapolis. Street outreach team. We have emergency shelters. We have rapid rehousing, and we have permanent supportive housing. Individuals or families that are experiencing homelessness could gain access to these programs by going to any of these programs. So for example, if you show up to the Day and Resource Center, anybody at that office could assist them on getting onto the wait list for emergency shelter and permanent supportive housing by connecting them with coordinated entry. Similarly, if they're already in an emergency shelter in our county, the shelter staff will be able to help them get into either rapid rehousing or permanent supportive housing by connecting them with coordinated entry. These are all the services that kind of we provide in the county on a regular, ongoing basis. This is our team. Zenny, so just so you know, as far as coordinated entry goes, this is kind of who our team is. Zenny is the individual that answers the phones. He's our triage specialist. If anybody's seeking any type of assistance when it comes to homelessness, Zenny's the usually first point of contact when it comes to phone conversation. That's me right there, Justin. I actually manage the entire operation. So I'm doing a lot of the behind the scenes stuff, and I supervise the team. Patty's the one that's actually managing the wait list. So she's taking a look at the different individuals that have been screened for shelter. She's looking at where the availability is, and she's making sure that the right people are able to get into the right places. And Francis is the individual that's following up to make sure that people that are on the wait list aren't forgotten, that people, if they're still in need, that we could connect them potentially to other resources while they're waiting for either shelter or housing. And making sure that if our outreach team needs to be involved, or if a day center or another agency needs to be involved while they're waiting for shelter or housing, that those connections are being made. So the four of us are constantly working together to ensure that all the resources are readily available for individuals or families that are in need. And it is a 4-person team just managing the different lists that we're looking at. I wanted to briefly go over how the shelter system works, and then how permanent supportive housing works, and go on from there. So vacancy is the first part in connecting someone with shelter. The shelters let us know when there's a bed open. So for example, Lighthouse will call us and say, listen, we have 2 people that left last night. We have 2 male openings. Or Sarah's House will send us an email in the morning saying, you know, we have a 4-bed family unit open today. So we're constantly up to date on where all the openings are. The screening is done over the phone. As I was saying, Zenny does the screening, realizing that some of my, see some of what I wrote because your wonderful photo, images are in my way. And then priority. So one thing that's different about coordinated entry, one thing that we strive to change is how the wait list functioned. And priority is a huge part of this. For emergency shelter, we prioritize those that are living outside. So the wait list for shelter is not a first come, first served list. If we have 2 individuals that are on the wait list, for example, and one of them is living outside and the other is living with a family member, we're giving priority to that person that's living outside, regardless of who called us first. That's our main priority. We have other priorities as well. Anybody that identifies as a veteran becomes a priority for us. We want to make sure that anybody that has served is not on the street. We try to prioritize them for shelter, and we also try to prioritize them for housing when housing openings do occur. So our main thing for shelter, though, besides being veteran is being outside. Those are the two things we are constantly looking at. Placement, so using that priority list, we place individuals and families into the shelter when there's an opening. And we also have meetings on a weekly basis where we're talking with the shelter providers, the day centers, and the crisis response system. And we're meeting with them, and actually that meeting's going on right now. We have that weekly meeting to ensure that we don't miss anybody. If someone's going to a day center and somehow they weren't good at making phone calls and we didn't get them on the screening list, or they were nervous on the phone and we didn't get them prioritized correctly, these weekly meetings help us make sure that, number one, we're transparent with our process, but number two, that we're making sure that we're giving the correct prioritization and serving the people that need to be served, that are outside in the community. I'm realizing I have to take a sip. Not used to so much talking. All right. So that's how our shelter system works. I might have to cough here in a second. Actually grab some water. Permanent supportive housing functions a little bit differently. Better. If you're not familiar with permanent supportive housing, I'm going to go into a little bit more detail in an upcoming slide, but I'll kind of give a brief overview. Permanent supportive housing is a housing intervention for individuals and families experiencing long-term homelessness. And permanent supportive housing is broken up into two different types of housing, either voucher-based or what we've referred to as project-based. Project-based is typically there's a facility or a group home. Voucher-based is kind of a piece of paper that allows you to take it anywhere within the community that accepts the voucher. So you use independent landlords or project instead of a specific project or a specific building. But similarly to how our shelter system works, we manage the wait list for those permanent supportive housing openings. So if the Housing Commission or Mental Health Agency or Arundel House of Hope has openings in those programs, they contact us. They let us know that there is an opening. And when there is an opening, we have that prioritized list. And we look at that list and we try to identify the individual or family that has the most service needs, that's been experiencing homelessness the longest, and that's either outside or in an emergency shelter. That's where our prioritization comes. Sorry, I don't know what's wrong with my throat today. So we look at that prioritized list very specifically to make sure that we're prioritizing the right people, those that have been homeless the longest. Again, we also prioritize those that have been that served in the military. So if we have an individual that identifies as a veteran, regardless of their discharge status, versus an individual that had never served, we would prioritize the veteran first. So we do have our street outreach team that usually walks side by side with the individual to make sure the application process is done correctly. And once they receive the voucher, we help them with actually finding an apartment. I think I got a cough here, so hold on. I apologize. Early in the morning for me. So, all right, so our permanent supportive housing programs, and I'll go over how many we have in the county in just a couple minutes. But that's how the process works. So meetings are wonderful. You guys have meetings. We have meetings. We have a lot of different weekly and monthly meetings that we have within the coordinated entry programming. So one thing, like I said, we have a meeting where we meet with all the shelters on a weekly basis. We have another meeting that focuses specifically on families. That's on a weekly basis. We have a veterans meeting. It's a by name list meeting. that we started a couple years ago. That's on a monthly basis, and we're starting a behavioral health meeting. The idea is to constantly collaborate with our partners to make sure that we're doing due diligence with identifying the most appropriate people for the housing and shelter resources. We don't want one provider to be savvy on the system and get all of their clients into housing while other providers don't know the system and are unable to assist. We want to make sure that our approach is as fair as possible and as transparent as possible. So we try to partner with as many agencies and partners as we can to make sure that that is consistent, which means that it means that we're in meetings a lot, but I think it's important. So that's why we do it. All right, shelter, the capacity piece, I think is something that a lot of people think about or wonder about. Emergency shelter provides 90 days of shelter support to individuals and families. So just if you're not aware, typically an emergency shelter stay is 90 days. That's by definition what emergency shelter is. Our three main shelter providers in the county is the Lighthouse, which has 30 beds for males, 15 beds for females, and 4 units for families. If you're not familiar, that's located in Annapolis on Hudson Street. They also have a day center, and they provide a lot of community resources for individuals or families, whether they're experiencing homelessness or not. So if you're not familiar, that is a good provider. They're all good providers, but they're really excellent. Sarah's House, which is located on Fort Meade property. They have 6 to 10 beds for single adults, depending on how many families they have, and they have typically 50 to 60 beds for families, which equates to about 20 rooms for families. Winter relief typically starts in October, ends in April. The COVID-19 pandemic kind of changed things around a little bit for winter relief. But prior to the pandemic, they were serving usually between 50 and 100 people a night. And during the pandemic, it dropped considerably to about 25 a night or less, many times less. We assume that things will probably get back to closer to normal this coming winter, hoping that nothing else disastrous happens. So we manage waitlist for all 3 of those shelters, though. Permanent supportive housing. So for permanent supportive housing, there's our 3 main partners. The Housing Commission of Anne Arundel County has a specific program called the SHP program, and they serve typically 50 individuals and families. That program, I think, is just about full. We have maybe 2 or 3 spots left. The Mental Health Agency has 2 different programs. One is called the COC program, and one is called SHOP, or Supportive Housing Opportunities program. And they're able to serve typically between 40 and 50 individuals and families, depending on composition and size. Both the Mental Health Agency and the Housing Commission programs are voucher-based, which means, again, the individual is able to move to a place of their choosing, as long as it's within the price of the voucher, and they're able to find a landlord that will rent to them, which is very challenging in this rental climate right now. There are not very many housing units open. The rental market is extremely high, and the vouchers are extremely low. The average voucher is around $1,150 for a 1-bedroom. It appears the average low income or average affordable housing unit in the county is around $13 for a 1-bedroom. So the voucher is typically a few $100s less than our average housing units, which makes it extremely difficult to find any housing for people that do get vouchers. Where our housing specialist comes in to try her best to find those units. Community houses, so Arundel House of Hope has a couple group homes that they manage, and they're able to serve 3 to 5 people in those homes at any given time. They're spread out throughout the county. All 3 of these agencies, all 3 of these programs are lifelong programs. So permanent supportive housing means not only is the person able to stay there for the rest of their lives, assuming that they abide by the rules, but they also have a case manager that follows them during the life of their program. So we have case management support on our team, as well as the mental health agencies, different targeted case management programs, and Arundel House at Hope. The purpose of permanent supportive housing is not only to provide the housing, but to make sure that the individual is able to maintain that housing. That's my crash course. Like I said, could go on for hours and talk about different things, but I wanted to try to keep it concise here and ask if you guys have any thoughts or questions. I know chat has a couple. In regards to the HUD-VASH program, we do partner with Maryland VA Healthcare, but we don't really have much impact on how the VASH vouchers are distributed. I think I've spoken to John many times about this. I don't think that there's a lot of ability to impact that list as much as we like or would like to, but yeah, we can get people on the list. Outside of that, we don't know what happens afterwards.
Justin, I think there's another question in the chat from Cynthia.
There's a whole slew of them. Sorry, Justin. As you were going, I was just like, this is amazing. This is amazing. And I was trying to gather all my thoughts. And so I apologize, but don't apologize for throwing them all at once at you.
No, it's no problem. I'll try to go through it here. So the question: are there other counties/jurisdictions that function like this? Part of the reason why we're doing coordinated entry is because HUD decided that if they were going to give us money, we would have to implement a coordinated entry system. Right. So that's a nationwide thing. Now, we definitely do it different than other counties and jurisdictions. We think ours is the best. That's why we chose it. But every county in Anne Arundel County, or every county in the state of Maryland, should have some sort of a coordinated entry process. All right, so what were some of the barriers to transition to this? How did you overcome them? Any barriers that still exist? What did that timeline look like? It took a few years to set this up, and we started in 2016. And I think the pandemic, as far as silver lining goes, actually helped us with making this even more functional. When a lot of the agencies kind of closed their doors, it forced agencies that were kind of reluctant to be a part of coordinated entry to realize, hey, we don't have to have people coming into our office anymore. They can just call DSS and they'll handle it. That sounds great. So the main barrier was to get buy-in. When we told the shelters that we were going to manage their wait list for them, some of the shelters did not think that was a good idea or didn't want to lose control that they had on making decisions on who they were going to serve. Same with the permanent supportive housing programs. Instead of having their own wait list, we would provide them with names, and we were providing them with the most difficult clients we could possibly find, because those were the individuals that had been outside the longest. So the main shift was getting the buy-in from the providers. Now that we have the buy-in, I think everybody realizes the importance of it. The amount of long-term homelessness in Anne Arundel County has decreased significantly. When we first started this, one of the first people that we were able to house had been homeless since the 90s. So they'd been outside since I think it was like 94 that they became homeless. The fact that they had been out that long was completely amazing to think about, but we housed them in 2018 and they're still in their apartment today. Things like that it shows the success of this, where without coordinated entry, they would still be outside.
Justin,
some barriers that still exist is, accessibility is always going to be an issue. We can't get everybody as much as we've tried. There's capacity issues. There's substance issues, there's mental health issues. We unfortunately had an individual die last week that we had been trying for months to help him get into housing. And the main barrier was for him to stay engaged with us long enough to see out the process. So sometimes it's just the process that takes too long and becomes frustrating for the individuals that we're trying to work with. But yeah, it took a couple of years, and like I said, the pandemic really helped us out. Is an unfortunate thing for us.
Justin, I don't mean to interject. Can you hear me, Justin?
Yeah.
Kadena has a good question. How can agencies make referrals to the coordinated entry program? I can type the number in the chat. And then John also has a specific question on can we summarize the veteran homeless the status, and maybe talk a little bit about the veterans monthly meetings that you have.
Sure. I was just going to say we partner with Maryland VA Healthcare. So Lauren Biggs is the outreach worker that is assigned to our county. So anytime we do have a veteran, we reach out to her to verify their veteran status and try to get them on the HUD-VASH interest list and see if there's other resources or opportunities that make sure that they're linked up appropriately. Making referrals to coordinated entry is typically a two-part process, or depending on if you're looking at shelter specifically, there's a phone number, and I'll type in the phone number. That's Monday through Friday, 8 a.m. to 4:30 p.m. I should mention that's a Google number. Some people get kind of thrown off when it says, please state your name, and Google will try to connect you. But we use Google numbers so that way if we have a staff member call out or a staff member change, or if we have to work from home, we don't have to give different phone numbers. So that way we could move the phone to whoever. Anybody looking for shelter could call that number. The other main thing that you should know is how to reach me. And that's my info. And I'll give you my phone number too. Calling me if you're unable to get in touch with someone through coordinated entry. I respond to email pretty quickly. I respond to phone calls as quickly as I can. I also accept text messages at the network cell. Usually answer on the weekends and after hours as well, and be on call for after hours. I know Gloria has touched base with me on the weekends before, and that's fine. I'm not that I want to be on call 24/7, but the work's important, so I don't want someone to be left out because of something like that, and my life isn't that interesting. If you're interested in learning about the permanent supportive housing programs, that wait list is functions a little bit differently. We really want to hear from the providers first and then the individual if you're trying to refer someone. So if you have someone that you're looking specifically for housing for, I would either email and call me first. If you're looking specifically for the shelter as the entry point, you can call the shelter screening line. Feel free to also send me an email saying, hey, this person screened. They called the screening line today. One thing that we try to do is get all the information that we can from the individual when we do our quick phone assessment. Sometimes individuals don't share with us everything. We may say, hey, are you a veteran? They may say no. But what they meant to say was yes, for example. And then we don't have the right prioritization. We're not prioritizing them. Or we may say, are you staying outside? And they may say no, because they're staying in their car. Well, the car and outside for us is kind of the same thing. So when providers email us and kind of say, hey, this person screened, it allows us to make sure, again, that the individual is able to represent themselves appropriately or correctly and accurately so that we could properly prioritize them for openings. Because there is a wait list for these programs.
I think Stan has a question.
I have
Sure.
a variety of speeches to make, so I'll start off with the coordinated entry. Yes, as every county has its own. I'm Montgomery County. I'm a commissioner with the Interagency Commission on Homelessness, and we are the best, but we appreciate you're trying to emulate us. Secondly, there's several programs that I don't know when people call in Are you affiliated with Alliance? Because they're an SFVF provider. Supportive Service for
Yeah, they're
Veterans
our
Family.
provider as well.
Okay. And at the same time, I also volunteer with MACFET, the Maryland Center for Veterans Education and Training, which is specifically geared to working with veterans. And so there is room available, and they have procedures for entry with regards to COVID requirements. But hopefully you're connecting with them. Last but not least, I'm also going to talk about employment, because a lot of the shelters, once you address some of the barriers, then it's helping them become self-sufficient. So there's an organization that's working out of Baltimore called Streetwise that you might want to connect with. Two, when it comes to them calling in about they're almost on the verge of homelessness via eviction, we hope you'll look at the Maryland Department of Veterans Affairs Trust Fund, because we have given out probably about $200,000 to ensure veterans are not homeless. So I think that's an important part. That's just number, very important to be coordinating with the trust fund, whether it's utilities, whether it's rent. I mean, that's what it's, again, the trust fund is not an emergency. You can't call up and right away get it. They have to go through a process of dealing with the director, who in turn approves their request and then sends it up through a panel of 5 or 6 individuals, and then the secretary will eventually approve. I mean, it could happen within a week, but normally eviction notice, you're going to have at least, depending upon when they notify you, they're going to give you at least 30 days, if not longer. So there's an opportunity that way too. So thank you for the opportunity to do what I just did.
Yeah, and I won't argue with you on Montgomery County. You guys actually have been quite an inspiration to a lot of our processes. So I'll give you that, but I will claim second place.
I think John had a question about summarizing the veteran status of homelessness in the county. Where things stand.
What do you mean by status, John?
I had to get unmuted. Justin, what I'm trying to figure out is the big picture. How are you doing with veterans? Is the number increasing, decreasing? Is there any common threads of need that you can identify that other organizations might help with to help the veterans in this case?
You know, John, it's an interesting thing when it comes to homelessness in general. I mean, you house two people show up, and with our veteran population, it's unfortunately kind of similar. With prioritizing veterans, it means we house a lot of veterans each year, but it also means, unfortunately, more veterans come by. I think we have, our numbers. Sorry, I'm trying to I think jump ahead without explaining. So let me settle down for a second and say, for us, homelessness that we utilize by definition is individuals or families that are either staying in a place not meant for habitation or in an emergency shelter. So we recognize that there's a lot bigger group of individuals or families that are on the verge of experiencing homelessness, but not quite there. So oftentimes when we talk about numbers and statistics, we're looking at a very specific part of the population, and it's those that are outside or in shelter. And that figure for us is quite low in Anne Arundel County, thankfully, and it's partly because of the prioritization we do. I think that we have right now maybe 4 or 5 individuals that are in shelter and 1 or 2 that are on the street. And when I say 1 or 2, when I give numbers like that, it's people move and change, and we haven't had contact with one individual since January, but we think he's still outside somewhere. Oftentimes what we see as far as our largest needs is determining eligibility eligibility for programs, oftentimes trying to get a DD-214. And we try to partner with Maryland VA Healthcare for that, and they have their ways. And sometimes it works, and sometimes it doesn't. We have a 72-year-old individual right now in shelter that we've tried for many years to get a DD-214, and we can't get it. It doesn't exist. He claims he's a veteran. He swears up and down, but the VA systems have no record of his existence. Those are some of the problems. The other thing is a lot of the VA-funded housing resources are in Baltimore City or the Baltimore County, and we have veterans in Anne Arundel County that will not leave Anne Arundel County for anything. They would rather sleep outside in Anne Arundel County than go into a Macbeth or a Project Place or Baltimore Station. So understanding that, we do have Patriot House in Brooklyn Park, but even there, for our veterans that are in Annapolis or Glen Burnie that are experiencing homelessness, oftentimes Brooklyn's too far north for them too. But I think that we do, and it's another part of the reason why we try to prioritize the veterans, because we know that the opportunities that normally would exist for a Baltimore City veteran doesn't necessarily apply to the veterans in Anne Arundel because of the specifics of where they want to be.
Mm-hmm. I also think that Dr. Tanya had a question regarding referral process to our veterans to these homelessness programs. I think, as Justin said, anyone can make a referral to the coordinated entry program, but I also think maybe to address some of the other questions, Department of Social Services partners with a lot of and as many community partners that will make referrals, and will stay in contact with Justin's team, as well as to provide some of the other resources that Stan was talking about. So like, for instance, iCommunity Connection Services is one of the community partners working with Justin's team. And when we have specific veterans that come in through the county, through the Department of Aging's 410-222-3500 number, and we're aware that they are having homelessness or need longer term placement, if we are not able to find housing ourselves, Justin's team is one of the teams that we, reach out to. We're also a part of their veterans monthly calls. And if we're having challenges with something, I know we had one case, we were kind of talking it through with Justin to come up with ideas. So ways that veterans are getting referred to this is either doing things like this, making sure that our veteran partners know about it, but also agencies that are aware of it. Justin's team has done a great job of reaching out to them and saying, come be a part of our veterans collaborative that speaks specifically to homelessness, and let's work together.
Justin, as a follow-up to that, do y'all have like a one pager or a flyer or something that we can also easily share and get the word out, whether they live or work in Anne Arundel County or happen to know someone? So I think that's the biggest barrier, right? Is, do I know where to go? And y'all centralizing that number makes it so much easier than trying to navigate web pages. So if y'all have like some sort of marketing material that we could all push out.
We created a little folding guide that kind of highlights very specifically starting points. It isn't designed to provide an individual with all the resources, but the sort of starting points where they can then be connected to what they need. I say that because we used to have this big guide of phone numbers, and we steered away from that because we realized that you get a list of phone numbers, it's tough. So I could email Kia that to share, and we're always looking for feedback too. So if you look at it and you're thinking, well, why is he, what is this? Definitely let me know, because I would be really interested to see how we can improve what we have. We haven't really distributed it out widely just yet, but feedback is definitely important.
And I can definitely, after this, get that and push that out, and also try to capture some of the questions that are in the chat that if we haven't gotten to, we can try to find answers to and push those out to the group as well. There is one good really question. Is transportation an issue? Justin, do you guys speak to transportation? I forgot, I know we've discussed this before, but in getting to the shelters?
Transportation is definitely a tricky subject. We try to partner with crisis response and Arundel County's crisis response system. They've helped with transportation to get to shelter. We've also, we have a van now, our department does, our unit does. So we do have some staff members on our team that will help with transportation as needed as well to try to fill that gap. But overall, we can't, between the two agencies, we can't be everywhere for everyone. And transportation in the county is obviously a barrier when it comes to other things, getting to medical appointments, getting to jobs. Individual that has a job in Glen Burnie and our two shelters are in Fort Meade and Annapolis, they have to make a decision. Are they going to be able to get to work? If not, are they going to have to accept shelter and quit their job, or keep their job and not accept shelter? So definitely challenging with the transportation, and I don't think we have the answers just yet. I wish we did.
Mm-hmm.
We're trying. We're better, but we're definitely not where we need to be. We could get people to the shelter, but that only helps so much.
Thanks, Justin. As you can see, your presentation, and you do, thank you for what you and your team does for homelessness in this county, but also specifically for the veterans and their families in this county as well. As I said before, we'll try to capture the questions that were in the chat, maybe that didn't get answers to, and we'll try to push that out along with the one pager. I think Stan put the, or Kat put the Maryland Trust Fund website on the chat, I think, for those that are looking for that as well. With just a few minutes that we have remaining, we just kind of want to open it up to the floor, to the group, to one, maybe recommend to us any other partners that we don't have involved in this group, maybe that we should reach out to and have them get involved, but also wanting to get your thoughts on what topics you would like to hear more about, or maybe your organization wants to present, to make sure that we're all aware. Just wanted to throw it out for comments to the group. I see that.
Yeah,
Doctor.
this is John. Can I respond to that?
Absolutely.
For you and Justin and everybody else listening, for a long time, I've tried to quantify or prioritize needs among the veteran community and the people serving the veteran community. What are the most important steps or priorities of action that might be taken to help people? And if you turn that around, what might be the priority steps to take to preclude veterans, in this case, developing problems with their, once they separate from active duty? So they kind of two ends of the continuum here, the beginning end or the end, the other end. You can preclude problems, I think, at the beginning, and then try to take care of them at the other end. I'm trying to understand where should there be priorities and what would those be? Okay, thank you.
And I do think that we're trying to capture some of that through the data, and that we're reporting with the Department of Aging. So for those that don't know, as a part of our grant with the county, we're trying to capture all of the different veterans issues that have been coming up, and housing has been a great challenge, which is why I wanted Justin to speak to the housing issue here. But it doesn't seem to be, I think, as Stan said earlier, a one issue thing, because it can be housing, but then you also have to address the employment need, sometimes also even the food and clothing need. So that's why we're trying to work with as many veteran organizations, but also other social services agencies and organizations to provide things like the transportation that you might have a job, but you don't have the transportation to it, and trying to meet that as well to prevent some of the problems and issues that they're having. So it seems like it's just multifaceted. But I think Mr. Cray had a question or a hand raised.
I did. Good morning, ma'am. Just a little information that might be helpful to the vet population in Arundel. I'm the director at the Dundalk Vet Center. But starting August 1st, we have opened up a cap at the Reserve Center across the street from Fort Meade, where we're going to start offering mental health services to the veteran, active duty, and reserve community right there, a little closer to where the population is at. It'll be by appointment only, so they'll still call through the Dundalk Vet Center to get them set up. But we're trying to increase services in that area and potentially down the road set up a permanent office. So I just wanted to make you all aware of that. If you have some clients that are closer to Fort Meade than some of the other vet centers, that'll be an option here starting in August.
Can you put some of that information in the chat so that I can make sure my staff has that? Because we
Absolutely.
get calls about that as well.
Sure,
Awesome.
you betcha. Appreciate the time.
Kat? I think, see your hand raised.
I'm good, thank you.
Okay, Cynthia, I don't know whether you still have a comment or question. I saw your hand raised as well.
I always have questions, but no, I was just applauding Mr. McRae saying that they were adding some additional services down there for the Fort Meade centric folks. Thank you, though.
Mhm. Any comments on topics that you all would like to hear, or if your agency or the work that you're doing, you think that you would like to do a presentation to the group so that we can learn more about what you're doing? Stan?
Well, Dr. X knows we're working on a program called Combating Substance Misuse Impacting Maryland Veterans, Service Members, and Their Families. So we'd love to do a presentation next time we have an opportunity to talk about some of the things we found and what we're hoping to accomplish in the future. Because as my fellow veteran advocates, especially Dr. Macri, keeps sending me notes that we've had more overdose deaths. We set a record last year in the number of people who died from overdoses. So I don't care what people tell you, how great they seem to be doing, it ain't good enough. So we just need to continually talk about it and focus our attentions to some of the things that can be done. The other thing I also wanted to bring out, I don't know if your organization connected with Saratoga Warhorse. That's out of Baltimore County, and they provide treatment for veterans for post-traumatic stress. And so, again, it's something you may want to look into, because you're not just going to be staying at a place. You've got to have other goals when you're formerly homeless. Unfortunately, or fortunately, I've worked with homeless since the 1980s, and I thought I had solved it already, and it looks like I didn't do a very good job. So I'll keep on working at it.
Thank you, Stan. And I do think Dr. X has mentioned the work that you're doing and about you wanting to present. So Dr. X and I could reach out to you next time about getting that set up for our next meeting. Absolutely. It's been a lot of great resources that you're providing. I know Vanessa from my team, we're taking notes. And so we'll reach out to some of the places that we're not connected with. And that's the whole point of this forum, to make sure that we do get connected so that those services can be provided to our veterans right here in Arundel County as well. Anyone else have other thoughts? Kat, what's the Eastern Seals Homeless Veterans Reintegration Program? Did you want to speak to that, or if not, we could just check that out?
Hi, I don't know much about it. I work for Arundel Community College, so I don't work for Easter Seals, but I do connect with the Easter Seals staff members a lot for providing some additional support for employment and kind of helping veterans get back on their feet again. It looks like Stan is raising his hand there, so he probably knows more about it than I do. But I do know that they have Easter Seals, our local Easter Seals group has been pretty phenomenal in supporting veterans on a whole bunch of different levels. But their homelessness veterans integration program, especially the one they have for women specifically, I have interacted with, and it has been very helpful.
Again, they are a recipient of federal funds under Homeless Veterans Reintegration Program, HVRP. And Easter Seals has had that for, oh God, almost 12 years, if not incorrect. And they work within your area, both for veterans as well as for female veterans. So, and again, they're also connected to Veteran Staffing Network, which is, I'm going to go into. Employment is an important part of addressing homelessness because people have to have goals. And goal is not, I'm going to get a job. The goal is, where do you go once you get the job and where's it going to go to? So one of the things I've been working on with Montgomery County is employment and looking at entrepreneurship. So there's a gentleman named Anthony Butler who did a presentation for us, and you might want to think about doing similar, who talks about small business development and entrepreneurship, because some of the homeless individuals are not, quote unquote, going to take a 9-to-5 job and stay on the job. That ain't the way it's going to happen. Some of them need to do their own business, whether it's car detailing, whether it's window washing, whatever it might be. We need to be prepared for that also. And there's an organization called CHOW, which works with veterans to help them understand the catering business, and they do their food truck. And CHOW is another organization that I've been connected with, in which they are entrepreneurship, so you can learn how to operate a food truck and then eventually own one if that's where your goal is. Sorry, I don't mean to monopolize. I apologize.
No, Stan, we'll definitely circle back and try to reach out to you after this month. It sounds like you have a wealth of knowledge of different organizations, and we want to make sure that we're bringing those to Anne Arundel County. And Dr. Tanya, I did just want to plug the county's number again, 410-222-3500. If you are trying to make a referral for a veteran in our county and that can be for any service issue that they have, legal issues, disability, mental health, the whole gamut. I think we have time maybe just for one or two more comments. Yolanda, I think you had your hand raised.
It went flying out of my brain. Project Opportunity. I'm sorry. It was the entrepreneurship piece. The Let's Chow food truck that Stan mentioned. Project Opportunity also provides some entrepreneurship opportunities, and I believe it is veteran as well as military spouses, etc. So I think it would probably be a really good idea if you have not attended Anthony Butler's career. It's like the fourth Thursday career club. It's a Maryland career club. It gives you a great overview of information, but it may be useful, Dr. X, to have Anthony on this call. And I say all of this because of working for Easter Seals and the Veteran Staffing Network and knowing some of that. And I am the recipient of a certification, if you will, through Project Opportunity as an end-of-life death doula. And so they helped me, paid for it, the whole thing. So thank you. That's it.
Thank you, Yolanda. And I do want to be mindful of everyone's time. I know we probably have 10 o'clock meetings to get to, but I do think that I've taken some good notes, and I'm going to try to research some of the organizations that we've mentioned out here and probably try to send it out in a follow-up email so it's all in one place, along with the maybe PowerPoint and the one pager from Justin. And I definitely wanted to just thank Justin again so much for the work that he's doing and for the information specific to veterans as it relates to homelessness in this county. Dr. X, did you have any final comments to close us out?
Just want to say thanks again for carving out time in your schedule. This has been great. Justin, what a fantastic presentation. You're going to get called again, I'm sure, for future presentations. Again, thanks again. Appreciate your time. The chat, the recording and all that, I'm going to pull that together once it is downloaded and hopefully get that to you by the end of the day, if not tomorrow. But thank you again. And Kia, over to you.
Okay, we will see everybody next time. Please go ahead and don't forget to register for our next monthly meeting. Bye, everybody.
Take care. Bye.